What is Stendra and how is it used? Stendra, avanafil, is a prescription medicine used to treat the symptoms of erectile dysfunction. Stendra may be used alone or with other medications. In combination with sexual stimulation, avanafil works by increasing blood flow to the penis to help a man get and keep an erection. This drug does not protect against sexually transmitted diseases such as HIV, hepatitis B, gonorrhea, syphilis. Consult your doctor or pharmacist for more details. Dosage and administration. Read the patient information leaflet, if available, from your pharmacist before you start taking avanafil and each time you get a refill. If you have any questions, ask your doctor or pharmacist. Erectile dysfunction. The recommended starting dose is 100 mg. Stendra shall be taken orally as needed, as early as approximately 15 minutes before sexual activity. Based on individual efficacy and tolerability, the dose may be increased to 200 mg taken as early as approximately 15 minutes before sexual activity, or decreased to 50 mg taken approximately 30 minutes before sexual activity. The lowest dose that provides benefit shall be used. The maximum recommended dose and frequency is once per day. Sexual stimulation is required for a response to treatment. Stendra may be taken with or without food. Contraindications. Administration to patients using any form of organic nitrate is contraindicated. Hypersensitivity to any component of the tablet. Warnings. Patients should not use if sexual activity is inadvisable due to cardiovascular status or any other reason. Use with alpha blockers, other antihypertensives, or substantial amounts of alcohol greater than 3 units may lead to hypertension, erection lasting greater than 4 hours. Seek emergency treatment. Sudden loss of vision in one of both eyes, as is called, be a sign of non-arteritic ischemic optic neuropathy. Stop treatment and seek medical attention. Sudden decrease or loss of hearing. Stop treatment and seek prompt medical attention. Alcohol consuming greater than 3 units may increase the potential for orthostatic signs and symptoms. Combination of other PDE5 inhibitors or erectile dysfunction therapies is not recommended. Adverse reactions. Headache, flashing, or dizziness may occur. If any of these effects persist or worsen, tell a doctor or pharmacist promptly. To reduce the risk of dizziness and lightheadedness, get up slowly when rising from a sitting or lying position. Remember that this medication has been prescribed because your doctor has judged that the benefit to you is greater than the risk of side effects. Many people using this medication do not have serious side effects. Sexual activity may put extra strain on your heart, especially if you have heart problems. If you have heart problems and experience any of the serious side effects while having sex, stop and get medical help right away. Severe dizziness, fainting, chest, jaw, left arm pain, nausea,